heart health. Why are you talking about this to us, Nishma? Like we're just in our early 30s and like early 40s. Don't you think like we're too young for this? I mean, like we have better things to talk about, Nish. And then later, after 2 days, the same friends of mine call and they're like really, really worried. And they're like, Nishma, what is this? What are we hearing? Like a close friend of ours who was working at his workplace in the office suddenly collapsed of a heart attack. Like, is this really normal? Is it really because of the vaccine? What is happening? Okay, so the same thing I wanted to talk and discuss with our Dr. Nishant, who is our in-house cardiologist at Nikhil Hospitals. And he's done his MBBS from Kurnool and then his PG from the reputed Jayadeva, and then he's done his super specialty from PG from Vaidehi and his super specialty from Jayadeva Institute of Medical Sciences, and he's done his fellowship from Germany. So yeah, I invite Dr. Nishant to join us. Hi, Dr. Nishant. Hello. Just a second. Let me connect. Nishant?
Hello.
Hi, Nishant. Can you hear us?
Yes. Hi.
Hi, I hope you're having a good Sunday.
Yes, absolutely. I'm very excited actually to do this. Makes it even
Yeah.
more exciting Sunday for me.
Yeah. So, Nishant, so I just want to start it off very quick because we're already late by 10 minutes. So, what exactly is this sudden cardiac arrest and why are we hearing about it off late, Nishant? Can you please just put it to us?
So basically, what everyone should understand is what exactly is a sudden cardiac arrest. So the sudden cardiac arrest and heart attack are two different entities. So sudden cardiac arrest is when suddenly the heart beating stops, and heart attack is essentially if there is any blockage in the blood supply to the heart, then that leads to a cardiac arrest. So, heart attack is one of the causes of cardiac arrest. There are multiple causes of sudden cardiac arrest and sudden cardiac death. So, in that, heart attack is one of the cause. Why exactly it is happening recently? There are multiple factors. There is an increasing incidence of heart attacks in younger people, and increasing incidence of stress, which is leading to all abnormal rhythms in the heart, and suddenly it is causing a disruption in the cardiac activity and leading to sudden cardiac death.
Then cardiac arrest is same?
No, absolutely not. This is a very important distinction that people should understand actually. When everyone says sudden cardiac arrest or sudden cardiac death, as I said, is when the heart beating stops. Absolutely. It is an electrical problem of the heart, as opposed to heart attack. Heart attack is essentially when there is, as even for the heart, there are arteries that supply blood to the heart. So there are three major arteries that supply blood to the heart. If any artery is blocked, or if the blood supply to the heart is reduced for multiple reasons, like a clot formation in the heart or anything, then in that case, we call it as a heart attack. So heart attack leads to sudden cardiac arrest, and heart attack generally people will have symptoms like chest pain, excessive sweating, palpitations, and there are all the other symptoms, which is like a warning sign for people. So that gives a warning sign, and then that will lead to a sudden cardiac arrest. Which that's why when people get all these symptoms like chest pain, sudden onset breathlessness in the night with sweating, then they should go and get themselves tested in the hospital so that they don't go to that stage of sudden cardiac arrest.
Okay. And why are healthy individuals getting it? Like all of a sudden, like very healthy people who work out a lot, and these people are also having these heart issues. Why?
So there are so essentially there are risk factors for any cardiac disease. I will categorize them mainly into two things. One is modifiable risk factors and non-modifiable risk factors. So essentially, non-modifiable risk factors are things like age, genetics, and primarily these two. And modifiable risk factors are anything like your lifestyle in terms of your hypertension, in terms of diabetes control, cholesterol control, and stress, and good sleep, physical activity, and all of this. So, if there is people, what you're talking about is that people are addressing the modifiable risk factors. In that also, I don't think that, just workout is one aspect of a modifiable risk factor. But in general, if we go into detail of, how their sleep is, how their lifestyle is, how their stress levels are, and multiple things, then that can be one of the reasons behind all this increase in heart attacks.
So you mean
And one more thing, as
to
I've said,
say,
is,
yeah, you
and one more thing
mean
is
to say, so
the
stress and mental health play a very important role in heart attacks. Like that, it
apps.
is one of the major reasons of getting.
Absolutely. Stress and mental health are very, very important risk factors for heart attack, cardiac diseases, and all of that. And one factor that I should have mentioned it before was we are living in a post-COVID era. So this is a completely different generation that we are living in. So that COVID and post-COVID era comes with its own set of complications, thrombotic complications. Essentially, thrombotic complications means risk of clot formation anywhere in the heart arteries. And along with all the other risk factors that I've mentioned, so this just increased in the current generation. So that is why I think that there is an increase of incidence of heart attacks in the young people in this generation.
Then what is this new thing that we're hearing? People who have taken this Covishield, do you think they really have to be worried about it? Is it the Covishield that's causing these heart attacks?
No, I don't think people should be worried about it. That there is a less than 0.1% risk with any vaccine or in general, like any infection itself, that can cause some sort of complications. But if you take it as a macro population scale, it is not something that you should be worried about it. Risk again. I would want people to focus on how their lifestyle is, how their mental stress levels are, mental well-being is, and essentially, COVID vaccine is a very, very important step in controlling COVID infection worldwide. And if we had let COVID spread, then COVID itself comes with its own set of, thrombotic complications. And post-COVID, as I said, it's very difficult to make that distinction between a COVID infection, post-COVID causing complications versus someone who had COVID and has taken a vaccine. And after that, if they have developed some sort of a thrombotic event, it is very difficult to make that distinction. So a lot of people are feeling that okay, this is what has caused. I took a vaccine and then I'm getting some sort of symptoms, or I'm not feeling well. But they don't understand that there is a big chain of events that are much there before taking a vaccine, which can cause all these complications. So nothing to worry, absolutely. Just concentrate on your mental well-being and physical well-being, and that should do its job.
And the next one is, what are the screening protocols that you would suggest for all these young individuals for detecting any heart issues?
Yes. First and foremost is they should, from a cardiac point of view, they should get their ECG. There is a 2D echo and a treadmill test. all these three I would recommend. These are very simple, non-invasive tests. It'll take less than 1 hour of someone's day, and you can get all these tests done. Any cardiologist will be able to do it, and this will give a very good idea about how their heart health is. And TMT essentially, because it has exercise involved in it, a lot of what we are listening nowadays is people suddenly collapsing when they are exercising. So treadmill
Exactly.
test it's a wonderful test. Is a wonderful test where you can assess someone's physical tolerance, exercise capacity, and ECG changes during exercise, which will give us an idea about how their peak tolerance is, how the heart is functioning during exercise. So that these three are basic tests from a cardiac point of view, and blood tests. They should get their routine tests, like how the cholesterol is, how their hemoglobin is, how their sugars are, and all these regularly. That is absolutely once a year. And if as age increases and people with the risk factors, I mean people who already have some sort of cholesterol, who are on medications, who have sugar, blood pressure, and all, they should get it done more frequently, like something like a 3 months or 6 months, based on how well or not controlled it is.
What about the CT angio, Nishant? CT coronary angio. At what age should a patient get a CT coronary angio done? Because of late, I think because of this, like the tension, because most of these people, like in their 40s also, they're getting a CT angio done. Do you suggest a 90-year-old to get a CT angio done? Like to check for blocks, like randomly along with these tests, do you suggest that? Or do you think like they can wait for a CT angio, coronary
So
angio?
first,
Yeah.
yes. So what CT coronary angio has two aspects. One is there is something called a calcium scoring, and then
Hmm.
we do the CT coronary angiogram, where we actually look at the vessels. So
Hmm.
first, calcium scoring on a CT coronary angio is a good screening test to see in case if someone has some sort of a cardiac risk factor. I think it is, but it comes anything. CT comes with its own set of radiation and all of that. But I would still recommend, it's a wonderful tool for people. I think above 40 years of age, or any risk factors, or even if people are less than 40, but if they have risk factors, as I mentioned, all the risk factors before. If that is the case, then I think people should go and get a CT coronary angiogram. First, at least the calcium scoring is good. It will give you a basic idea about how your risk factors are. And then if calcium score is very high, then we can do CT coronary angio and then take it forward from there.
Okay. Any nutritional deficiencies that would predispose a person to get cardiac arrest or something? Is there any nutritional deficiency that a person should be worried about?
So, balanced diet is absolutely essential for maintaining a healthy heart. So, when I mean balanced diet, it should have all the forms of nutrients. So, be it, your good amount of, proteins and vitamins, minerals, and even essential fats and all of that. So,
Hmm.
we have to look at the diet in terms of, like including your greens, and including good level of carbohydrates, everything in its own. There is a recommended daily allowance for everything and all of that. And primarily, most importantly, even though people have, like, our primary meal is rice based or all of that, there are a lot of vitamin and mineral deficiencies that we see in general population, and especially all vitamin D and vitamin B12, all the B complexes in general deficiencies are not good, and they can lead to a cardiac event, a heart attack, and all
Hmm.
of that. And even there are some recent studies that show that magnesium is very important in diet, and sometimes even magnesium deficiency also can cause heart attacks in population. But I absolutely recommend people to take some form of supplementation in vitamins to help them with their general overall well-being and a healthy heart.
Okay, perfect. And is this a myth that if you work out a lot in the gym, that you are like there is a chance of your heart stopping? Is what like few people are really worried because of a few cases where in the gym a lot of people are collapsing. So is it true that like if you work out a lot, also there is a chance of a cardiac arrest?
No, see, absolutely, that chance is always there. So we have something called, we need to know the functional capacity and an exercise capacity of an individual.
How
So,
would that how would a person know that, Nishant?
so one basic first thing, very simple test is a TMT, a treadmill test. And there are
Hmm.
higher levels of tests. There is something called a stress nuclear test, and even in TMT there are multiple forms. Like instead of a treadmill, there is a cycle test, bicycle ergometry test, and all of that. But I think everywhere where you see, and it's a very simple test, is getting a treadmill test done. But I would like to, I think everyone should know that treadmill test I should be done under the supervision of a doctor. So a lot of times I
Hmm.
see in diagnostic tests where there are people who they just do the test because there is some person who's just running this thing, and what will happen is actually, as we have spoken about it, when someone is exercising, there is a chance that they can collapse. There can be multiple arrhythmias. Arrhythmias means some sort of a rhythm abnormality in the heart, which can cause a person to collapse. And if that so always, even when we were getting trained, we would always be there with the patient when he was getting, and we would monitor the patient. How it's just not a graph that we see. We would monitor the patient's how he's doing in terms of his functional capacity during the test, and is he getting any symptoms during the test, which is very important. And a lot of times I have seen a whole array of arrhythmias, abnormal rhythms, chest pain, sweating, people collapsing. So you need immediate medical attention while during the test, while doing a treadmill test.
Yes.
So, but I think yes, yes, absolutely. But I think treadmill test is a good way to start and assess your
So
exercising
that's a
capacity.
basic test. Okay. That. And
Yes.
about this, what effects do smoking, vaping, and substance abuse have on the cardiovascular health in young individuals?
Absolutely. So there is smoking has a direct one-to-one relation with a cardiac disease. It causes heart attacks. There is no questions. So substance abuse also is known to cause a direct one-to-one cardiac disease. But again, substance abuse, there are multiple types of substances. There are sympathomimetics, there's a cocaine and all, or morphine, which completely reduce the respiratory drive and all of that. So they all act in different ways of causing a heart attack or a heart problem, but everything has a direct association with heart disease. And smoking is known to cause thrombosis. So there is clot formation in the heart, which will reduce blood supply in the heart, causing a heart attack. One of the major things that we see is young people, even less than 45 years of age, when they come with a heart attack, a lot of times it is because they have history of smoking or some form of
Smoking,
substance
substance
abuse.
abuse.
Yes.
Okay. Now that we are very clear as to like what are the factors that are causing and what are precautions we're supposed to be taking, now let's go to the procedures that can be done if there is a blockage. Do we really have to be worried? Like, what is the window? Like, how long does a patient take? Suppose if there is a patient and he gets to know that there is a block, does he have to get what are procedures have to be done, and how fast, how early has it got to be done? Like, what all are the
So,
procedures that you see?
yes, yes. Cardiology has evolved rapidly in terms of technology. So there is cath lab. I think it started just something in the late 80s to 90s, if I'm not wrong. But in the last 20 to 30 years, the amount of technology that has come and the amount of procedures that we can do in a cath lab is amazing. So just starting is, again, angiogram. Angiogram is a very basic test. So angiogram is nothing but study of vessels. So coronary angiogram means we are studying the vessels of the heart. So it's an invasive procedure that we do in a cath lab, but that with that test we will get to know in case if there is any blockage in the heart. We have three coronary arteries primarily. So in the three arteries, we have one on the right side and two on the left side which supply the heart. So we get to know if there is any blockage in the heart. Even if there is a blockage, where is the blockage? What is the extent of blockage? How severe it is? And what should be done for that? If there is a blockage, if it is significant, means whether we should whether we should go for a stenting, an angioplasty, or whether we should go for a coronary artery bypass graft surgery, or just put on medicines and all of that. So based on an angiogram, we get to decide. And again, as you have asked me already, what to do if there is a blockage. So that we have to
as an
assess the
interventional
angiogram anatomy.
cardiologist. Okay.
As we can do something. We do something called a coronary angioplasty. An angioplasty is nothing but we take a catheter until the heart, and then over a wire we pass a balloon and a stent. So we pass a balloon, we go where the block is, and we open the block, and then again for that block to not close, we put a stent over there. So and it's a very relatively simple procedure. Nowadays, as I said, with the extent of technology.
Procedure?
So we do it with just yeah. So we just put a small needle here. That's it, in the radial artery, or so we either use a radial axis or a femoral axis. So it's nothing. We just give a small injection. We don't even give general anesthesia. Nothing. It's just a small, like how small. Just the pain is for a small needle prick. That's it. And after that, everything we do from this small prick, we go till the heart, and everything will be able to do. And the patient will be completely conscious when we are doing all of that. So relatively, I would say, painless.
How many hours is the procedure? How many hours does it take?
A coronary angiogram would take, yes, a coronary angiogram would take, the main procedure will take just around 15 minutes. That's it. And coronary angioplasty, depending on, how many blocks, how many stents and all, but as sometimes even 30 minutes from half an hour to, it can go up to like 3-4 hours and longer depending on the complexity.
Okay. And how many days should the patient stay in the hospital?
So this is my favorite part about, cardiology, where it is just amazing what technology has now, as opposed to what people were doing 10-20 years back when there was a block. When we do a coronary angioplasty, we discharge the patient in 24 to 48 hours. So either sometimes the next day itself, or in 48 hours, in 2 days. So if everything is...
Are there any medications that... Okay. Are there any medications that the patient has to, like, cardiac ante, people will be like, oh my God, it will be followed by so many medicines. Like, do I have to take so many medicines after discharge? Like, is there how many medicines does the patient have to take, and for how long is the patient supposed to take those medications? So
for heart attack patients, generally we give something called blood thinners. So depending on, what is the extent of block and if we have done an angioplasty stenting, we do advise them, we do prescribe them blood thinners. So blood thinners and some cardioprotective medications so that, they don't get another heart attack in the future. So that's why, and I think with medications, sometimes there can be like 3 to 4 post-discharge. And on follow-up, we keep reducing it over a period of time. There are patients where, in long-term follow-up, only one tablet he had to take a lot of times. So as that myth of, heart means multiple medications. Yeah, eventually, yes, we can bring it down to one tablet.
Oh, that's amazing. And when can the patient resume back to his work, like workout and everything, his regular schedule? When can the patient get back to his regular schedule after the procedure?
So after the procedure, if everything is stable, something like 15 days should be a good time to get back to their physical activity. So the thing with the angioplasty is we do not advise bed rest. We ask the patient to move. So even if we get discharged, we ask the patient to be active. He does not need to be on the bed completely throughout, because there is nothing there. There is just a small prick. We just put a band-aid and send them home. And after that, they can go do everything. but we just give a period of 15 days to monitor how he's doing, symptoms and all. So I'll ask them to come back to me once within 15 days and just see me once. And after that, they can go back to work.
Oh. So you mean to say that immediately next year also they can start doing the regular work if they want to, like not the strenuous activity, but yeah, they can just like carry on with the regular activities at home.
There are people where even on the same day we have done an angioplasty in the morning, and by evening we have mobilized the patient. He can go, the patient can go and do all their regular activities in the hospital, in the sense they walk around, they eat by themselves, talk to family, everything they can be normally, just like any other person. And even if it is a very complex case, also in 24 hours they can get back to being normal.
Oh, that's amazing, Dr. Nishant. Thank you so much. You've answered almost all the questions. So is there anything that you want to talk about? Is there anything that we missed and you want to talk about those specifically?
So, as a closing note, first of all, thank you, Dr. Nishma. This was amazing. It is, anything that educates people is worthy, especially in this era where there is so much misinformation that is being, it's taken by storm. So, in this era, it's a wonderful initiative that you're doing in terms of, educating people in the right way. And I think in terms of all the risk factors and all of that, I would like to tell them that, one is absolutely it is important to keep your risk factors of cardiac disease under control. So always, make sure. So when I mean risk factors, this is what I want people to know. So it is not just your sugar, your blood pressure, your cholesterol levels. It is getting your 8 hours of sleep. It is, having that mental well-being, your personal well-being, your professional well-being. Just being in a state of uh, happy has its own effect on the heart. So along with this, your diet, in terms of just having a balanced diet and being active, being physically active. I would recommend everyone that they should do 30 minutes of exercise for 5 days a week. It is absolutely essential. So by doing all these basics right, you can. It's very very possible to keep all forms of cardiac disease at bay. So with this is one very important thing, and I would still tell people, don't get carried away with all the misinformation about anything that is happening in the post-COVID stage, about let it be vaccine or COVID infection or all of that, but they should be wary of it. So they should come and get it checked. They should always come and get, as I've said, let it be your ECG or an echo or a treadmill test. These, because they are very, very simple, relatively inexpensive. It will just cost very little amount of money to get these tests done, but it will be very, very invaluable in terms of, in terms of assessing someone's health and especially someone's heart health. So I would recommend, I would please request everyone to do these two things, in terms of risk factors, assessment and control, and get themselves tested.
Thank you. Thank you so much, Dr. Nishant. Thank you so much for giving us your time on a Sunday. And I hope all of you got your essential requirements, whatever you all wanted to know about your heart health. So sleep is not only called beauty sleep, so it's very important for your heart as well. So please take care of yourself. And if there's any concern, reach us out to Nickel Hospitals. We're always available. We are a family of doctors. So thank you so much for your time.
Thank you, Andy, everyone. Thank you.